Hello guys, and welcome back to another video here on Kyle Does Nursing. I hope you guys are well. For those that don't know me, my name is Kyle Sands. I am a second year adult student nurse at the University of Worcester. I transferred from paramedic science in my second year straight into my second year of adult nursing at the University of Worcester. 3 years ago, I decided to document my journey here on YouTube to become a paramedic, and obviously things have changed since then, but I decided to document my journey. So today's video is my first, so I've just started placement, my first ever placement as a student nurse, and it's my first week. So I'm going to talk about where I'm going and how my first week went as a student nurse. In the meantime though, if you are a student nurse or you're interested in the content I'm making, and you can relate to it, or you know someone who can relate to it, maybe share it with them, or I would really appreciate it if you can subscribe to this channel and smash the like button as well. That would be amazing. It kind of enables me to know if you enjoy the video or not, if that makes sense. So first off, I think it's probably best that I start off by saying where I'm going on placement. So I'm going to an acute respiratory unit. It's a 12-week placement block, and it's an 17 bedded respiratory unit. They have 2 respiratory high cares, so I think there's 4 beds in each of the high care, so 8 beds in total, which is really interesting. What's really good as well is I can take my knowledge and some of the skills I picked up from paramedic science and take them over to nursing, because in paramedic science for my pathophysiology exam there was a lot based on the respiratory system, and we did a lot of assessments obviously regarding the respiratory system as well. So I feel quite confident going into this placement. I wouldn't say I feel overly confident, but I like the fact I know a little underpinned knowledge of the area that I'm going into. So for the first week I had 3 shifts, 3 12.5-hour shifts. You deduct 1 hour for your breaks. So I start at 7 o'clock. Handover is from like 7 till 7:30, and then you finish at, what do you finish? 7:30, that's right, 7:30. Obviously at 7 o'clock you then give handover to the night staff, and that's how it works. You're then, at the start of the shift, you're put into teams. So I'm in team B, which means I'm looking after a certain bay, and it also means it kind of, you know when you're going on break. So I go on break at 10:30. That's because the team, there's team A and team B. Team B goes on break at 10:30, which means that team A are always on the ward and vice versa. So actually for the whole week, I was on team B. So not only did I know every day what time my break was for the week, I actually looked after the same patients. So I had 5 patients. There was a side room, which this patient had infectious tuberculosis, so you have to wear all the PPE to go in there, obviously, because it was really infectious. So that was in the side room, and then there was 4 beds in this other bay. 2 of them had type 2 respiratory failure, and the other 2 had like an exacerbation of their COPD. For those that have started placement their very first day, you know how nerve-wracking it is, because you don't know where things are on the ward. You don't know what to expect. You've never met any of these people. Not only you've never met the patients, but you've never met the members of staff that you're working with. So I was really nervous actually on the first day, and actually to be honest the whole week, because it was kind of the adaptation period. I think that's kind of your adaptation week. You don't know where things are, you're going to be nervous, and they kind of know that. They were really nice, very supportive, and they showed me around as soon as I got there. So they took me through an induction of the ward, where things were, where the crash trolley was in case anything went wrong, where the staff room is, and where you get changed, and everything like that. But really good. I was then shown to where I'll be looking after these patients in the team B, and then the nurse came to greet me and sort of went over what we do. So she kind of explained the process of the day. So at 7 till 7:30 we have handover, and then about 7:30 to 9 or 10 there's like the medication round, getting patients up, helping them, assist them with personal care. Then we kind of do a drinks round. I helped out with the healthcare assistants. So at because it was my first day, I just wanted to watch and kind of observe what was going on in the ward, if that makes sense. I just wanted to take a step back So I watched the nurse do her medication round at the start of the day, but then I went and helped the healthcare assistant. So I felt quite comfortable doing the healthcare assistant roles because I pick up shifts on NHSP, doing bank shifts on NHSP, so that's kind of what I was used to. So I watched the nurse do her medication round, and then I went and helped the healthcare assistants, you know, assist the patients. Most of them was quite independent, so it was just changing the beds, but one of them, you know, needed a bit more help with personal care as well, so I helped out with that, which was really, really nice. What was really, really nice as well is throughout all of these days, I was looking after the same patients, so I really, really got to know them, and I had the chance to, because I was supernumerary, I had the chance to just talk to the patients, you know, when I wasn't doing the nursey jobs. I just had the chance to just sit down and talk to them and get to know them, get to know their life, get to know their diagnosis, and just really get to know the patients. Then at 11 o'clock I helped the healthcare assistants do a tea round, you know, whizzed it around, some biscuits and some cakes. 12 o'clock was the lunch soups, so I helped out do that and did the dinner round, and then at 2 o'clock was the medication round. Again, I just stood back and watched the nurse just do the medication round for all of these times. So there's medication round at 8 o'clock, a medication round at around 2ish, and then there's a medication round around 5:30, 6 o'clock as well. Then, so obviously I, like I said, stood back and watched kind of what happened. There was nothing really I'd done to sign off my proficiencies this day. It was just the adaptation period, meeting all the people I've been working with, meeting the healthcare assistants, and just knowing the routine of what they do. Then I came in the next day, so I was on, the first day I was on Monday, 7 till 7:30. The next day I was in again, so I was in Tuesday. That was 7 o'clock to 7:30. Today I was still very, very nervous. I was working with a different nurse this time. She was a COPD specialist nurse, which she was so knowledgeable and had so much experience. She's been working in there for like 15, 20 years. Had so much experience because we were dealing with two patients that had an exacerbation of COPD, and my assignment that I'm doing at the moment is a case study about an exacerbation of COPD. So she had bags and bags of knowledge for me as well. So literally from the get-go, loads of knowledge she was giving me, and it was just amazing. She was really, really patient with me at the start, all the way through the shift. She had the mentality and the work ethic that she was showing me how to do it at 8 o'clock on the medication round, and then I can show her exactly how she showed me on the 2 o'clock medication round. So that's exactly what we did. I watched her medication round at 8 o'clock, and then at 2 o'clock I'd done it. She was there to assist me. She was watching me every second, and just I sort of did it on my own. So I did the checks that you need to do, gain consent from the patient, and just did it on my own. There was some times where she stepped in, and there were a couple of injections that I could have done, but she said I would do them this time, and then next time maybe you can do them. So at 8 o'clock at 7 o'clock, sorry, there were 2 Clexane injections which I could do. So at 5 o'clock she showed me some injections beforehand, and then I put it into practice then, gaining consent obviously from the patient at 7 o'clock, and done them myself, which was really, really good because I kind of watched the nurse do it beforehand a couple of hours earlier, and then put it into practice then 2 hours after, which was really, really good. I think that's a really good way of learning. So like I mentioned, it was the same patients that I dealt with beforehand, but this time it was with a different nurse, a COPD specialist nurse, so she had so much knowledge for me. And then the next day, I was working with the same nurse, so the COPD specialist nurse, and she was like, well, you didn't do the 8 o'clock medication round this time, so do you want to do that? I said, yeah, that'd be really, really good. So I did the 8 o'clock, the 2 o'clock, and the 6 o'clock medication round with assistance. So she kind of showed me beforehand and was always there. I this time did 4 Clexane injections, which was quite an achievement for me considering I've never done one before. Starting on Monday, it is now Thursday. So today was my last day, well, the day I'm talking about, which is a Thursday. So I did Monday, Tuesday and Thursday this week. This was my last day, so I did 4 Clexane injections, which was really, really good, and I kind of seen the improvement of myself and how I felt more confident in doing so. Even just talking to the patients, I'm very chatty. I'm quite easy to communicate with. I'm very chatty with patients, so because I had the chance to get to know them and knew their story and knew their diagnoses, they felt comfortable with me doing so. So I always gain consent If they say they didn't want me to give the Clexane injection, completely fine. I wouldn't feel no hard done by at all. It's their choice. They're all very much comfortable to do so, and they gave me some feedback and said, you know, how well it went and how you communicated with me really well, and that really meant a lot, actually. But this time on day 3, on the Thursday, the COPD specialist nurse said, you know, you've got one patient that you're going to look after in terms of not just medication. I did the medication for the 5 patients I was looking after, but it was more doing the nursing notes, handover at the end of the day. I actually didn't hand over at the end of the day, but I did all the nursing notes for this patient. Anything that needed doing or chasing up, or, you know, calling, I need to call someone to chase up results. That was all my job. Obviously she helped me with this. And actually when I left on the Thursday, I felt like I achieved something, because I came in on Monday not knowing what the hell I needed to do. To the Thursday, I felt like I learned something, if that makes sense, and I really felt like I knew what COPD actually was, and tuberculosis was, what causes an exacerbation, and I actually really enjoyed that. And I wanted to do a video next time talking about what I learned about COPD and an exacerbation of COPD, and what tuberculosis is, and all that sort of stuff. I think that would be really valuable, and pass on the knowledge that that nurse gave me, and maybe pass it on to you guys. And maybe you guys can do that as well. If you know anything about any respiratory conditions, drop them down in the comments as well. That'd be amazing. So what I always do as well, I like to reflect, and that's the reason why I like doing these videos as well. It enables me to reflect on the week that I've done. Sort of after I've done that, I like to forget and go into my comfort zone, you know, do things that I enjoy outside of work. But it's also really important to reflect on your day, reflect on your week. If you had a bad week, reflect on it, maybe write it down, or do whatever you want to do. I like to just do this, talk about it, keeping in mind confidentiality of the patients, but it's a really good way of learning. So I went in on Monday quite nervous, scared, not knowing what I wanted to do in terms of on the ward. I didn't know where things were, and I didn't actually know what the role of a nurse did on the ward, did on the ward, if that makes sense. But then Tuesday and Thursday came, and I felt much more comfortable. And I'm really looking forward to next week to build on these skills from Monday, Tuesday and Thursday. Next week I'm working Monday, Tuesday and Friday. I don't think it's the same nurse, but I won't know obviously until I start. But I'm really looking forward to it. Really am. So if you have just started placement, the reason why I wanted to start this, you know, weekly update is because it is very nervous when you do start placements, and I just wanted to know that it will be okay. You will feel nervous, you won't know where things are on the ward, but eventually, when days pass, you become more comfortable, you'll get to know your patients, and the care inside that you have in you will come out, and the rest will just flow in front of you, if that makes sense. So I'm really enjoying it, actually. I was a bit apprehensive when I first found out my placement that it was on acute respiratory unit, but it has been amazing so far. Obviously I'm only 1 week in, but it is amazing so far, and I would like to say thank you for the continued support that you guys give me on this channel. Make sure you do like and subscribe down below. I really appreciate the support, and I'll catch you guys next Sunday for week 2 updates. Thank you. Bye bye.